Hey guys, we're gonna talk through prepping a tourniquet and also proper use of a tourniquet. So as you see, you'll get them like this. They'll be in a wrapper. All you gotta do is undo that wrapper, pull it out. You can keep that little paper if you want, but all you wanna do is stretch this out and make sure you actually have a loop. Most of them come pretty well prepped, but you can make this however big you want. I like to go a little bit bigger just to make it easier for use later. Make sure your red tab is visible for you. And then the other thing you want to do is make sure this timepiece is open for you to be able to stow your windlass once you've actually used it, okay? So keep that like that. And then what you'll do is you'll just kind of fold this up however you want, just to make it easy to deploy for you, okay? So I like to do it like this, and then you can stow it in there. You can put a rubber band around it if you'd like, just to keep it all together. You can actually strap this with a rubber band also on the exterior side of your kits for easy grab and use, okay? But that's how we prep it. Now for proper use, I'm gonna demonstrate it on a person and on myself, just so that way you see the purpose of having this so big. All right, so the first thing you wanna do is identify the wound. And the real reason you'd be using this is if you have hemorrhaging, meaning you have massive bleeding where it's a life-threatening bleed, okay? You can use it if it's just bleeding a lot as well. There is a lot of evidence and studies supporting that you can keep a tourniquet on for multiple hours till you get to your next echelon of care. And if you're in a relatively local, suburban, urban environment, you could get to a hospital pretty quickly. So, or an urgent care or something like that. So the next step is going to be just to actually bring it up over. So on this, let's say the wound is right here. All right, we're gonna wanna bring the thing just below that next joint, but you wanna make sure you're at least 2 to 3 inches above the wound, okay? So if that means if the wound is up here near the knee, you're gonna have to go above the knee to be able to actually stop that bleed, okay? If it's down here, you can stay below the knee. All right, so let's just go. I'm gonna pick up that thing. I'm gonna get all the way around. I'm gonna go above it. I'm gonna situate this there with the windlass. I like to always have the windlass over directly above the wound, wherever that might be, okay? So you're gonna strap this down pretty tight as you can go manually, and then you're gonna start twisting this, and it's gonna hurt them, okay? They are gonna be screaming. It is gonna be very, very, very painful, okay? So you're gonna twist this. I'm not gonna do it a ton because it's my wife and she'll kill me, but I'm gonna go that. You only twist it till the bleed stops. Once the bleed stops, you're done. You stow it. You put this here, all right? You can actually just keep wrapping this around so that way it's good and out of the way. You can tuck it in, whatever you wanna do, but you just wanna stow that so that way it's out of the way. I like to actually just figure out a way to kind of just wrap it around the windlass or something like that, or just Velcro it on top of itself to get it up out of the way and shorten it, okay? But that's how you do it. Again, this is 2 to 3 inches above the wound. If that means that you do need to go on to the next joint, you can redo it if you have to. This is only your initial setup for a tourniquet. If your tourniquet isn't being effective where it is, move it. That's fine. Okay, so I'm gonna go up here and I'm gonna go make sure you're a couple inches above that joint. I'm gonna tighten it down, and then I'm gonna do my twists until the bleeding stops. All right. Once you have this all done, you're gonna strap this down, keep the windlass in there, stow your loose end here, and then you're gonna take your marker that comes in your kit and you're gonna write the time you put that tourniquet on. And then you're gonna do whatever else you need to do to the casualty, if that's treating the other wounds, if you're gonna put additional dressing over the wound or whatever you're gonna do. But then once you do that, you're gonna go reassess that position of that tourniquet to ensure that it's in the correct spot, that it's being effective, okay? The only thing that matters here is that it's effective. It can be in the wrong spot, but it's got to be effective, okay? All right. The next thing I want to do, I'll show you real quick on this same video how to apply the tourniquet to yourself. Same principles apply. All right. So again, I have my prep tourniquet, and I have a wound, here on my leg. I have this so that way I can use this one-handed if I need to. If I have this hand is out of commission for some reason, I can still get myself around on it. I can get it up to where I need it to go. And I'm gonna just go high, because if you have a wound here and you are really that lacking, you're gonna want to get it as high as you can. And if you need to use leverage. But then I'm just gonna, you know, keep spinning. You need the mechanical advantage of this. That's the whole point of the windlass, is to keep spinning this around, keep spinning. And remember, it is gonna hurt, but it will save your life, okay? So then again, stow the windlass, put it in here, put your time, get yourself to the next echelon of care, call your wife, call your husband, call whomever you need to get you to the hospital if you can't drive, okay? All right, thanks a lot. Keep checking out the videos.